Hi, I'm Dr. Behnaz, a pelvic floor specialist. Today I want to talk about pelvic inflammatory disease, something that can leave long-lasting pain. Pelvic inflammatory disease is an infection that usually affects the pelvic and reproductive organs. In women, it often starts when bacteria travel from the vagina or cervix into the uterus, fallopian tubes, and ovaries. It's most often linked to infections like chlamydia or gonorrhea, but it can also follow childbirth, miscarriage, abortion. But here is something important. Men can also experience chronic pelvic pain after infections. While men don't develop pelvic inflammatory disease in the same way, untreated infections can cause inflammation in the bladder, prostate, or pelvic tissues, leaving similar long-term pain from scarring, irritation, or muscle tension. So this is not just a women's issue. Pelvic infections can affect everyone. Pelvic inflammatory disease starts when bacteria enter the reproductive tract and travel to the upper parts. The most common bacteria are sexually transmitted infections like chlamydia or gonorrhea. These germs usually start in the vagina or cervix. If they aren't treated quickly, they can move into the uterus, fallopian tubes, or ovaries. But sexually transmitted infections aren't the only cause. Pelvic inflammatory disease can also develop after childbirth when the cervix is more open and bacteria can move to the upper parts. Miscarriage or abortion, if bacteria enter during recovery, or ID replacement. It's rare, but infection can spread if bacteria are present at the time of insertion. Any vaginal procedure where bacteria have a pathway into the uterus. So, while many cases start from sexually transmitted infections, not all pelvic inflammatory disease is related to sexual transmission. It can also be linked to normal vaginal bacteria that travel to the upper parts in the wrong setting. In women, pelvic inflammatory disease may leave behind scar tissue or adhesions. Think of adhesions as a sticky glue that makes pelvic organs like the uterus, bladder, and bowel stick to each other. Instead of sliding smoothly, they tug and pull during movement, intimacy, or even bowel and bladder function. Over time, this creates deep, ongoing pelvic pain. In men, infections can cause chronic inflammation or scarring that irritates pelvic nerves and muscles. This can lead to pain with urination, ejaculation, sitting, or dull ache in the low back or perineum. After infection and scarring, the body often goes to in guarding mode. Muscles tighten to protect the area. Adhesions limit movement. Nerves become extra sensitive. This cycle, scarring tissue plus muscle guarding plus nerve irritation, explains why pain often continues long after the infection is gone. Now, the part patients really want to know: what can be done? I want you to practice breathing and relaxation. Your pelvic floor muscles often stay clenched after pelvic inflammatory disease. We use diaphragmatic breathing to retrain them. Inhale gently, let your belly rise. Picture your pelvic floor softening like a hammock. Exhale without tightening. A few minutes daily can break that guarding cycle. Then practice pain relief positions. When pain spikes, positions become medicine. Curl into child's pose. Hug your knees into your chest or lie on your side with a pillow. These postures unload the pelvis and give your body a reset. Perform gentle mobility and stretches. We add safe movements to keep tissues from stiffening. Figure 4 stretch. happy baby pose, cat-cow on hands and knees, pelvic tilts, and trunk rotations. These are gentle reminders that your body can move without pain taking over. If pelvic inflammatory disease or surgery left scar tissue, we use gentle skull release techniques, small circles, skin lifting, or sliding. In therapy, I also use my fascial release to soften adhesions and restore movement. Many patients say sitting worsens pain. Sit on a wedge or donut cushion. Avoid long sitting without breaks. And keep feet supported so your pelvis stays neutral. For improving the bladder and bowel habits, you need to know that straining can worsen the pain. I teach patients to sit with feet on a stool, lean forward slightly, and exhale instead of pushing. This protects the pelvic floor. Hydration and avoiding constipation also make a big difference. The other thing we should consider is that the chronic pelvic inflammatory disease sometimes irritates pelvic nerves. We reduce pressure by avoiding long hours on hard seats, using cushions, and practicing gentle nerve glides. Lying on your back, extending one leg at a time with calm breathing. I also encourage building a flare-up kit. Your cushion, heating pad, stretches, and breathing routine. Having a plan takes away fear and gives you control on tough days. One patient in her 20s came to me after multiple pelvic inflammatory disease infections. The antibiotics had cleared the infections, but she was left with aching pelvic pain and painful intimacy. We started with belly breathing, flare-up positions, scar release techniques, and cushions at work. Over time, her pain eased, and she told me, for the first time, I feel like I know what to do when the pain starts. It doesn't control me anymore. So, pelvic inflammatory disease can leave scars that change how your body feels and moves in both women and men. But therapy gives you practical tools, breathing, stretches, scar release, cushions, toileting posture, nerve protection, and flare up planning. You don't have to live with this pain. Relief is possible. If you found this video helpful, please subscribe to my channel, hit the like button, and tap the notification bell so you don't miss future pelvic health videos. Together, we can spread awareness and help more people find the care they deserve.